Hello guys, welcome back to the channel. It's Unit 12 Part E. Infertility. Infertility means when a couple is practicing a unprotective sex way or unprotective intercourse, but still after practicing for almost 1 year or above 1 year the woman is not getting pregnant, then it's a infertility condition. It is of two types, primary and secondary. Primary is the woman has never got pregnant in her lifetime. She is not even a single time she got pregnant and she is not able to get pregnant. That is primary infertility. Secondary is she got already pregnant, there is one living child and one or two living child, and after that now when they are practicing she is not able to get pregnant. That is secondary infertility. While according to the census, almost 8 to 12 percentage in this world the women are suffering from infertilities, and the causes are: one is non-preventable, another is preventable. Non-preventable in the sense, if a woman gets infertility condition because of this non-preventable causes, then we can't cure it. Like if it is due to any genetic problem or heredity problem or anatomical problem or any hormonal imbalance can actually be managed, but we can't assure that 100% it will be cured. Preventable cause we have infection in various way, like one is sexually transmitted infections or normal infections due to hormonal imbalance or due to any deficiency. This type of health conditions can actually delay the pregnancy condition. Apart from this, if a woman has any previous history of abortion, that is due to infection, or in the postpartum period if she had any infections or any abortional conditions and complications, mainly because of these previous things, the pregnancy condition can get postponed or can get delayed. And if she is exposed to any kind of toxic substances, one is environment, other is diet. If you see in environment, arsenic is main. Like if a woman is belonging to a poor family, she might go to a routine work like breaking the bricks in that environment. When she is breaking the bricks, from that dust arsenic is released, which is very dangerous. And if she is working any kind of agriculture way, pesticides will be used, and she is inhaling the pesticides spray or hair drops, then that will affect her pregnancy condition, that will affect her reproductive system. And if in lifestyle, if you see, that is diet, if the woman is involved in alcoholic and tobacco system, that also delays the pregnancy conditions. And if a child is forced to get married or early age marriage, and forced to get involved in sexual activities and multiple sex partners, and if she has any problem in her genital system, this all also can actually postpone the pregnancy condition. And if there is any pelvic inflammatory disease, like any injury or inflammation or damage or any kind of illness in the organs that is related to the pelvic or reproductive system, then that can actually delay the conception. Lab investigation, in that for male we have different, for female we have different. Absolutely. For male we will perform semen analysis. In semen analysis we have two conditions, that is azoospermia and oligospermia. Azoospermia means absence of sperm. Even after performing the ejection manner, there will be no ejection of sperm. While oligospermia is after performing the ejection manner, only a few amount of sperm will be released. That is low count of sperm. And next, in a female manner, we will see the basal body temperature, cervix mucus release. Based on that cervix mucus discharge, that is in jelly or white color discharge, whether it is in the thread form or whether it is very in light fluid form, watery form, based on that we will get to know how the process is getting inside, whether ovulation is happening in the correct date or not, whether ovulation is delayed, is there any problem inside or not, we'll get to know. And by endometrium biopsy and ultrasound, we'll get to know how the structure it is inside, is there any tumor present inside or any kind of obstruction is present inside, we'll get to know. And hormonal assay, because of this we will get to know hormonal production is correct or not, is there any hormonal imbalance or not, PCOD is present or not, or any kind of hormone disorder is present or not, we'll get to know. These are the lab investigation. Treatment in the medicational way, for the high estrogen level patient. For high estrogen level patient, we will provide a medication known as Clomid, that is also known as clomidphene, that is of 50 mg, and it will be given regularly for 5 days. At the time of night, the women should take one tablet for continuously 5 days. In fifth day afterwards, the ovulation occurs. How it works? Clamifene actually acts on the hypothalamus that will regulate the release of the FSH hormone, which leads to ovulation. In low estrogen level patients, we will give pregonal or pregial, which actually consists of FSH hormone and LH hormones, which actually leads to ovulation. Surgical techniques for infertilities. If we find any kind of injury or scar or any kind of abnormalities in the organs, we will try to correct it by using the medications. If that's not working, we'll go with a method known as artificial insemination and in vitro fertilization. And in artificial insemination, we will collect the semen from the husband, or if the husband is not capable for that, we will go with the donor's semen, and that will be inserted into the mother's uterus. In vitro fertilization, we will collect the mother's egg and father's or the donor's semen, and that will be fertilized in the lab and then get implanted into the uterus. Artificial insemination. This is a process where a semen is collected and that will be inserted into the uterus of the woman in an artificial way. So, the semen which is inserted will be very fresh. It's not a prolonged semen, because if it is prolonged, there might be a contamination problem, infection can occur, even the sperm might be dead. It will not be active and healthy. So, we will use the fresh one. And how the act is performed? There is a tool which is known as posterior fornix, and that will be placed in front of uterus to open the cervix. In the vagina, it will be placed the posterior fornix, and that will open, that will widen and open the cervix. When it is opened, with the help of injection that is connected to tube will be inserted inside, that will reach the uterus. When it has reached the uterus, the semen will be inserted, and this act will be performed generally before the ovulation process. For many women, at the time of ovulation, daily this process can be performed. For few women, one or the other day, like if today it is inserted, tomorrow no, and after the other day, yes, like that. In this, the semen can be collected from the husband or the donor. The husband, in the conditions like if he has any spinal injuries or any kind of injuries that he can't perform any sexual activities, then the sperm is collected from him. In the donor case, if you see, while collecting, we will make sure the donor doesn't have any kind of genetic problem or any kind of hormonal disorder, so that the baby which is born should be healthy. How IVF is performed? First, the doctor provides the stimulation hormonal tablets or injection to the women, because the egg which is produced should be very healthy. On a particular day, from a woman, the egg will be collected, and from the husband or the donor, the semen will be collected. After collecting on the same day, the fertilization will be performed under the microscopic in an hygiene manner, and for next 5 days the embryo culture will be performed, that is the division of cells. And if you read how the baby is formed, how the fertilization takes place, around 5 days the embryo which is getting formed will get in a ball like structure. That is what here. And this will be transplanted into the woman's uterus, and after getting transplanted, that is ET, after performing this, in next 14th day the woman gets pregnant. This is IVF. Congratulations guys, this is the end of the OBG syllabus, and now we have been reached the end. These are the possible questions from this chapter. Do practice well, score well. All the best for your exam. Meet you in the next video. Until then, stay tuned. Bye.